3, 2, 1. All right. Thank you, Brian, for being here. I'm going to go through just to let the listener know exactly who you are. And I'm still learning as I go. You have a master's degree in social work from Smith College in Massachusetts, where you studied on the cutting edge treatments of EMDR that effectively release trauma. Thank you.
Wonderful to be here, Rick. Thanks for inviting me. I'm excited.
And as with all my guests, forgive me for the questions that I do ask. Some of them are very basic, they're very simple, but the whole goal
No bad questions.
is to bring a lot of people out there that have trauma, and hopefully they're listening and they hear different modalities. I don't know if that's the right word of the different guests I've been bringing on.
A lot of different flavors.
And have to have professionals come on who have done the work, as you have. Your history was like 20 years.
20 years in social work. I'm now closing in on 2,800 hours with doing EMDR.
And now generally I just kind of jump in, but I need to start slowing down. And besides just this, what else have you been doing over the last 20, 30 years?
20, 30 years. Holy Dinah. The short version of Brian, I was born in Victoria, BC, raised in Vancouver. School was a bad fit, dropped out in grade 10. I was a bike courier. I became a father at 21, loved music and photography, and I knew lots of great but poor musicians, so I went with photography. So I did that for making a living about 15 years into my early mid-30s. And during that time, I was a seeker. I've been down spiritual paths and different things, meditator, and always loved people. And I discovered when you point a camera at somebody, you find out very quickly where they're at with themselves. 90% of us, you point a camera and you go, smile, I am. And I got very good and very patient at simply inquiring, talking them, getting to know them, very curious, and people would get back in their bodies. And the best comments I got were, looks like they were photographed by a friend. And so I reached my saturation point in that field, and a colleague of mine saw me looking kind of glum one day and to say, Brian, what would you rather be doing? I'm spending years in the darkroom. I was a master printer in black and white. And without blinking, I said, I want to be a therapist. And he said, well, hell yeah, go do it. So within probably 3 weeks, I'd signed up at a local counselor training college. Within about 14 months, I had my little diploma. And I went into private practice with a friend sharing a space downtown. Did that for about 3 years, working with individuals and couples. I recognized I wanted more foundation, more education, and also working more in the field. I had interests in public policy development, economics, social justice, all this stuff, and social work suddenly looked like where I should be. Did my BSW at UBC, came out of that, and the default position is child protection. So I worked in and around that for about 18, 19 years. North Vancouver, East Vancouver, last part of my career, about 12 years with the First Nations Agency, doing family counseling, all linked within child protection in the downtown east side mostly. And reached my saturation point with that. I'm 58 now. Wanted to do even more. I've been recognizing through Gabor Mate, Hungry Ghost, trauma basis of it's driving a lot of addictions and mental health. And also Basil van der Kolk in the States, his seminal book 5 years ago, The Body Keeps the Score. All these orbits around trauma started to make more sense to me. I had actually wanted to live in the States, in Massachusetts, for a variety of reasons. To work in the States, you need a master's. I put off my master's forever. Great, go to Smith College. Found a local clinical setting where I could do focused stuff on trauma. Turns out it was the Trauma Institute. Dr. Ricky Greenwald there, who's built his career around EMDR. And so I hadn't thought a lot about EMDR and suddenly was in the deep end of that. And their model is to do not just hourly sessions, but multi-day intensives. So you'd start on a Monday morning with a client. By noon, you've made a history and made a list of their traumas and done a test run with EMDR. We spend the rest of those days doing EMDR. By Friday, I'd be exhausted, the client would be exhausted, and all of their traumas would be at a feeling of 0 out of 10. And their boosting of esteem, or I'm lovable, or I'm worth knowing, would have come up to a solid 7 out of 7. And it was just miraculous.
What is EMDR? And it was I it's very new to me. Just the general public who has known of talk therapy for a really, really long time, hypnotherapy and so on.
Mm-hmm.
And as a common person, I hear about EMDR. And as I take as little as I can to find how fascinating it is, eye movement, and that's it. To me, it's just like, oh my God, this is awesome. So what is EMDR?
Right. Eye movement, desensitization, and reprocessing. So people are hearing about it and they read the first part of the resume, eye movement, therapy. Sounds weird. It's getting some traction in the public awareness now, mainly because of we're hearing about these miraculous results and people are going and feeling better. What is it? I've been working on this for several years. Bear with me. The short version is if you have an acute event, your normal cognitive processing of senses, information's going in, and we have an experience of grocery shopping, see a friend, nice linear story. Trauma interrupts. The hypothalamus sputters, doesn't know what to do. The limbic system kicks in, danger, danger, smoke alarms going off, and we're right back into the lizard brain. Survive. Do we freeze? Do we flee? Do we fight? And these all have different experiences in the brain. And we end up with an acute reaction to a situation where people, places, or things that might end up being associated with that specific event, we come around those again, and rather than going from a 0 to a 3 of maybe annoyance, we go to 10 or 11 panic stations, and then we end up in situations where we have PTSD, various of those symptoms. So EMDR would have an individual come in. They've had a range of experiences, one of events or patterns of things in relationship. So family of origin, very, very typical. Most of us didn't have perfect parents. Some had really crappy parents. So small t traumas, big T traumas, we come in, find out what the thing is. What did the person say? What did they do? And we go at it like this. There's a very structured flow through of EMDR and how we go at things. First order of business, we need you to generate an image representing the worst part of that incident. Go right there, get that image, make a note of it. This is kind of the pivotal piece for EMDR, beliefs. The second item is, this thing happened. What did it make you believe about yourself? I'm not lovable. I'm in danger. I can't handle it. I'm a bad person. A negative belief. Third piece, what would you prefer to believe about yourself? I'm safe. I am lovable. I'm worth knowing. I count. How true does that positive belief feel? Different number scale. 1 to 7. 1 not true at all. 7 completely true. At the outset, probably going to be a little low. Next one, emotion. Look at the image. Look at the negative belief. What's the emotion? Fear, terror, resentment, a lot of sadness. That's a very common one. How bad is that feeling now? 0 to 10. No bad feeling, all bad feeling. Usually north of a 5. Last setup, somatics. Where do you feel it in your body? Make a note of that. It's different for everyone. Then we get into the process. Hold the image in your mind. Move the eyes. 15, 20 seconds, deep breath. What came up? And this is where things get kind of ambiguous.
Right. So what's happening with the eyes?
Got it. Excellent question. There's a number of ideas. There's been a lot of research in the last few years. My elevator answer is we've inflated your limbic system. We've activated it. Image, feeling, sensations, emotions, activated the movie. Moving the eyes is a task. Okay, watch my finger. Oh, okay. Scroll, 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 scroll. If you're doing a task, you can't do emotion. They're mutually exclusive.
If you're doing a task, you can't do an emotion.
So if you're chopping vegetables, fixing your car, if you're doing a focused, acetylcholine is focus. Running a marathon, writing an exam, doing a task in a focused way. This is focused. Oh, okay, don't stop looking at it. You decouple the emotion center briefly. Then we take a breath, go back. Oh, we're back in the feeling, back in the movie. And the query at that point is, what came up?
This is so embarrassing, but this is so cool.
Yeah.
Maybe the listener might be like, oh, you didn't know that? I didn't know that.
I didn't know that either.
What you just said about the feeling. Okay, sorry. Continue.
It's fascinating. And it bears out. You can run your own experiment. If you're in an emotional state, particularly happy, particularly sad, there's reasons we talk about go for a walk in nature. If you're moving forward through space and time, moving your eyes, navigating, keeping your body erect, keeping the system moving, you're in a very basic part of the brain. And when we get comfortable in the space and we know that we don't have to think about tripping over roots or stuff, then we kind of drift back into reverie. But if you're focused, if you're riding a bike, there's going to be consequences if you don't pay attention. If you're scuba diving, there's consequences if you're not paying attention. And even though we've activated the limbic system with all this prickly stuff, I don't know about you, I don't want to look at that image of that thing my dad did me in the garage. Oh, thank God. Okay, this is a task. And we stop. What came up? The fun part is we don't actually stop thinking. And this distraction, this is where it gets into qualitative and speculative experience. The unconscious is if we take the pressure off that and let it be while we're over here doing this, stuff drips out. Tactile memories, smells, colors, images. Oh, wait a minute. No, it wasn't. The wall wasn't green. It was yellow. Right. It can be as innocuous as that. Because remembering that the trauma memories are inherently fragmented, scattered. That's why they're anxiety-inducing, because we haven't completed it. It hasn't gone back to the long-term file cabinet in the back of the hypothalamus.
How did this even come about? And I think I'll ask you just before we started is experiments are done and accidentally they find the basic ones that are part of pop culture is the light bulb, and Einstein to trying this. He ended
feedback
up finding
on a
this.
guitar.
Yeah, feedback on a guitar. All these things. How does one sit around and say, "Hey, I'm going to move my finger side to side," and all of a sudden, oh, I have EMDR. Maybe if you can briefly touch on the history of like how did this come about, and how long has it been around?
Great question. That's wonderful. So EMDR was formulated by Eileen Shapiro, a psychiatrist we'll have to look that one up. Psychiatrist, psychologist. Sorry, Eileen. About 35 years ago, 1989, Northern California. She was doing her doctorate at the time in English literature and looking at narrative, identity, writing, the novel versus fiction. And she'd had a breast cancer diagnosis. One of those very common situations, didn't notice anything, all of a sudden, substantial lump. And it was not a great diagnosis. I think it was, they'd said at that point it was going to be, hey, you've got maybe a certain time to live. It was pretty radical. And she was very distraught, naturally, went home, and my understanding is she did what we mostly do. She went for a walk, went through a local park, redwoods, walking through the park, birds, trees, breathing the air, seeing the light. Got home and noticed that she didn't feel distraught. And this was very puzzling to her. She said, well, wait a minute, okay. Good scientist, good analyzer. Got home, felt really crappy and scared. I'm here now, I feel calm. and I'm going to make dinner. Don't feel great, but I don't feel horrible. So she retraced her steps, and, well, we always hear about, if you want to feel good, go to nature, hug trees, go for a swim. But what does that actually mean? And so she retraced her steps and went through the process and went through it again, literally retraced her steps and had the same effect. So she determined that, okay, I go through space, move my eyes, and I feel better. What does that remind me of? Oh, REM sleep.
Rapid eye movement.
So REM sleep is, through a lot of MRI testing, is linked to the organization of memory. They can see the memory when you take somebody who's sleeping, and if we look at what areas of the brain are active, when we hit, look at that, there's activity in the memory center. What's going on? But it's short-term memory. It's not the long-term memory over here. Oh, the eyes are going. And so they made correlations between brain activity, memory centers, eye movement, and we've got qualitative reports from people for millions of years. Dreaming. I dream at these times, since they actually pinned it down. Oh, when do we dream? Eye movements. Oh, they reported certain dreams, dream content. They can analyze dream content. Was it resolved? Was it happy? Was it sad? Was there an emotional tone? So she went with that. Move my eyes, feel different. Is there a link? So she went deep down that rabbit hole and discovered, if you had somebody, kind of like in talk therapy, we're really well trained now as therapy patients. We go in, we tell our story. And she would become an expert in writing story from personal perspective versus like a script writer, where you're describing all the elements of the scene and who's going in what direction and set dressing, as opposed to internal linear experience. And she compared the two. And she discovered that if you described a bad event in almost like stage direction, okay, what's the lighting, who's standing where, what does it look like, what are they doing to you, what does it mean, what's my motivation? This is a classic actor's question. What would I prefer to believe? Actually, this actor wouldn't stand there, he'd do that. That happened when they were 3 years old. They wouldn't allow that to happen if they were 14 or 40. Can I change this story? So move the eyes, run this thing, and people inherently start to question reality. At a certain point, I notice in all my sessions with clients, anger emerges. Yeah, this awful thing happened. This person did this awful thing. God damn it, that was awful. They shouldn't have done that. And as soon as that comes up, we're into an adult brain that can understand the dialectics of right and wrong, justice, volition. I would stop that now, and they kind of rewrite their own story. That's why I said those two belief questions are really pivotal. EMDR really, and therapy pivots around getting from I'm a rotten, awful person to no, screw that. I'm worth knowing, and I have volition. So I'm going in about 5 different directions here, but she really twigged on that, had this working model, do these 8 setup questions, run this thing, and it kept repeating it, and people kept getting better. So you had people who would go into talk therapy, talking about, there I was in Hanoi and bombs are going off, or, oh yeah, there's my brother coming into my bedroom again. And in 1 or 2 sessions, getting to a point of not having a reaction to the awful image, just not comparatively neutral, or this felt sense of zero, of non-reactivity. And it's at this point when clients are doing a test run with EMDR, I'm quite clear about saying EMDR doesn't erase memories. It takes, as a clinical friend of mine in Vermont, he's an ex-biker, he speaks in more fun language. Yeah, we take horrific memories and we turn them into crappy memories. It's great. And it's very true. We can take something that is horrific and turn it into a garden variety thing that feels at about the same scale as the fender bender in the grocery store parking lot. Fell off your bike when you were a kid.
speaking of that, what can EMDR be used for? Because you've touched on quite a few kind of stories there, and I I mentioned off camera before we came on is I'm a big fan of narrative therapy, and I heard you mention the word narrative therapy. So first, what have you, through your experience, what have you used EMDR for?
Right.
I don't know if I said that question right. What is it used for? How? Yeah, I don't know.
What can I use it on?
What can you?
Okay. At the risk of sounding glib, pretty much anything, in that if something happened and it really altered your belief about yourself, your valuation of yourself, and we can talk about what is trauma versus not trauma. I have folks showing up with singular events. A performing pianist that had a nose job recently, and the operation went badly. So she's left with an altered face and a major legal process. So she came over for 2 sessions, and we worked through that, and she's now back at a point where she can sleep at night. She can practice and teach and move forward with her life. I was just working on Zoom this afternoon with a young Vietnamese woman in Montreal who had a very, very conflicted relationship with her parents. She's heading into being a therapist, and her parents wanted her to be a doctor, and she was trying to reconcile just that being disowned and blamed thing, that piece around her parents. Things like future performance. You can use it projectively. Something that hasn't happened still has a felt sense of, I can't, I shouldn't, I'm not good enough. And we can construct an image that represents that, even if it's okay, what would it look like? You can fill it in yourself. Even more interesting, what I mentioned earlier about making a chronological list of traumas and working through them, pre-birth. You could be in an embryonic state. You can know from siblings, relatives, neighbors, family lore, family stories about what was happening in your parents' life before you were born in your family. Were there tragedies? Were there mental health things happening or addictions that might have impacted you in vitro? If your mom is stressed, if you're being awash in cortisol, that definitely impacts fetal neural development, for instance. And so that is an imaginary and projective kind of thing. But one can still, if you grew up around these people, you can populate the image with, you know what the house was like, you know who was there and what they looked like. So you can construct an image that you can lock on and hold. And there's beliefs and feelings that came out of that family environment that you hold or feel. So that's a viable target as well.
And so EMDR is a tool similar to talk therapy and so on. So staying on the topic of EMDR for a little bit longer is, what's your approach? How do you use it?
Right. There seems to be a number of ways that professionals are taking it up. Because it's so new, 30 odd years, it's getting traction, it's getting known in the popular awareness. Some professionals are hearing about it, thinking, yeah, I need this because my clients are stuck and it seems to get leverage with people. So they'll go get training and they'll use it intermittently, like a one-of attempt. What I hear from the clients that I'm getting, because I'm declaring myself as a trauma specialist, it's all EMDR all the time. I'm having people show up and say, well, oh yeah, I did try it once or twice, but we did it for 10 minutes and I feel kind of, it didn't really do anything. And there's some folks that are doing it full time and may or may not be doing it in a fairly directive, or is that the right word? A particularly focused way. One man's opinion, one man's experience is, in the way that I was trained to do it in this intensive model, to really focus in and sustain somebody in that state with the image and keep working at it. is important. I think a lot of professionals, and I include myself in this for many years, we are appropriately trained to be very attuned to don't traumatize the client, don't hurt them, don't push them into a flooded state, don't make them dissociate. And yet the dilemma is people are showing up in front of me in that state or very close to it. I'm getting referrals from talk therapists whose clients can't get traction with talk therapy because they can't get past the awful thing or family history. So my position is there's really not much I could do or we could do as professionals really to make it worse. And we can create a container, certainly with therapeutic rapport. I'm a 6'tall, straight white male. I can be really upfront with that with clients. I might be a thing for you as well. Let's be aware of that. We're going to do it in this amount of time. We're going to create a container that you can put this stuff into when we're not together. And we can have imaginary containers or boxes, stuff that we can put it in, lock it up. That can give people a felt psychic arm's length from their stuff. I also offer clients, because we're going into cans of worms, we're not talking about career or challenges with relationship stuff, because what we're going to do is focus and hard. Between sessions, they can email or text me. Is that an extension of the therapeutic relationship? Yeah. Does it take me more than 10, 30 seconds to respond to a text? No. It's no real skin off my back. And I'm very clear with people, I'm not an emergency service. And maybe 10% of my clients make use of that. But it can help people get over a speed bump to shoot off a text saying, oh, wow, yeah, my spouse did that thing again. And I can go, we remember that thing we spoke about? Breathe, what do you see? Whatever management thing we come up with it. And I find that useful too. In terms of professionals' use of EMDR, in general, what I'm finding is some people are not doing it enough to get really conversant with it. And so if you get some real momentum with it going, you can get tuned into some of the subtle stuff that happens within the EMDR. There's definitely a pacing component to it. Part of the EMDR training is looking for and being able to spot, okay, is it done? Is it really done? So we're checking in once in a while. Okay, that thing with the carpenter and that thing they ripped you off. Start at an 8. Let's set it aside for a second. Just let your mind glance over the image that represents it. Where does it land now? Oh, 4. Okay, let's set a 4 now. What keeps that from being a 0? And often the response is, I don't know. Or, I'm still pissed at them.
Well, I have a question about that, and you brought that up. It's well, ask the question I had written out, and it seems that from a personal standpoint, personal perspective, talking your trauma out would be better than not talking about it. That's first and foremost. And a very special person in my life is someone who turned me into doing all of this, and it was because she ever so gently was able to kind of poke holes in my self-help world where we can just say affirmations and deal with stuff. And I didn't realize that how much I was smothering my actual feelings. I was never getting to the feelings. I actually never even understood that I had trauma. I didn't even know there was anxiety from it. And I didn't realize that my behavior was due to that until, and she was a doctor. She was a psychologist herself. She just talked therapy. And it was a total new world to me. So there I am on the outside, and the image I'll kind of create is you guys are a mall, all modes of therapy. You have your EMDR, you have talk therapy, you have the whole mall, and I'm on the outside. I'm telling people, hey, listen, this whole trauma thing, once you deal with it and heal, my God, life is amazing. I've had a great 4 or 5 years of just a really kind of quiet, good, clear life, and responsibility.
Yeah.
Responsibility, not being the victim anymore. Boundaries. Didn't even know what these words were. Yeah. Thank you so much for that. Mine came through talk therapy with my therapist, I think 3.5 months into it. And finally, when he looked at me, he said, I want you to know you're not the victim. My head exploded. And my first thing was, why didn't you tell me this 3 months ago?
It's a dilemma.
And it's like, and I didn't realize there's a process that they're going through. So that's the talk therapy. Yeah. And then, so I go back to, I'm standing outside this mall, of this building, and there's people are coming up to me. I'm making this scenario up, and they're saying, hey, listen, I don't want to do 3-4 months of therapy. I'm like, oh, there's this thing called
3 years.
Or 3 years. And he had said 10 years. And we're outside this place, and some of us don't even want to deal with it. Some of us, like I was completely either ignoring it. And then there are some people that, okay, I want to deal with it. But I want to know the fastest way, because I want to go through it and come out the other side. And for me, I think I took the ugliest path, but I felt the most effective for me was talking piece by piece about what had happened. Yeah. We went through a process, and it did wonders for me. At the same time, there are different ways of doing this. And getting back to the theme of the whole podcast is that to share this information for my folks that are on the outside that may be dealing with trauma, bringing guests on that have their angle on how they help you deal with trauma. Yeah. And so with that said, so talking about the therapy. So in your session, are we talking about what's happening?
Really good question. The short answer is yes, not as much as talk therapy. And we can go a number of ways on this. In that, I alluded to earlier, folks are showing up with me who are shaken to the point where they're not getting traction with talk therapy. Talk therapy is critically important in terms of the emotional safety and the holding and the rapport that occurs in talk therapy, especially when it's longer term, 6 months, a couple of years. Everything I know about changing human behavior and thinking patterns is it's about a 1 year to 3 year project. If you actually have goals, got supports, and you're working on the addiction or becoming a more communicative father or anything you can fill in that blank with, you want to change about our lives. And so the efficiency component of EMDR and some other stuff I do is kind of built around my model. I say on my website, this isn't talk therapy. The challenge is if we're traumatized, there is a very strong pattern of reiterating and rerunning that movie or the story. I'm a victim. They did that to me. They did that to me. And the trouble is when we do that, either within our own minds and experience, or if we keep reiterating that in talk therapy, we're basically just reinforcing the awfulness. Another clinical friend of mine uses this analogy. It's not particularly pretty, but it kind of bears out in a certain way. We're all familiar of hearing of teenagers, typically more females than males, but it's kind of an equal opportunity thing, of coping with hard emotion. And my clinical friend said this to me about a month ago, and it really rang true. As a talk therapist, having clients show up and tell and retell the awful story is they're getting the connection within a safe environment. They get to feel good when they're with me, and they tell this awful story, and I get kind of forced to relive it with them, and it's kind of like watching them cut themselves a little bit each time in front of you, and we want to interrupt that tape, because that's reinforcing this narrative of, yep, I'm still not lovable, yep, still not worthy, not lovable, not worthy. And getting out of that shiny with wear groove of self-reference is going to take a pretty major interruption. The interruption is the contrary information, either within a talk therapy concept of what your therapist did with you, you weren't the victim. Contrary information. Challenging the story. Yeah, you were sexually assaulted by your siblings, and I noticed that you're 40-something now. You've had successful relationships. You've been able to express your sexual needs in these contexts and that context. So it's not all tragic, but getting out from under the overarching story of reinforcing that. So that second belief question with the MDR, what would you prefer to believe about yourself? That's really powerful. A lot of clients struggle with that. Yeah, I'm awful. I'm just get used for sex. What would you prefer to believe? I have so much more to give. And having people bump up against that cognitively within the MDR process is very disrupting to that embedded belief. Very, very disrupting. And so doing that interiorly, consciously or unconsciously, and checking in on it numerically over and over within the process is phenomenally efficient. And let me throw this in too. The neural process, thinking process, is about 500% faster than the verbal cognition articulation process. So just on that alone, EMDR is, this also ends up sounding glib to say, it's X 100% faster than talk therapy, relatively speaking. That's another component.
Is it because we already have information back from hypnotherapy as well?
Oh, yeah.
That the effectiveness of that.
Hypnotherapy is wonderfully interrupting. Milton Erickson, I use some of his scripts. He describes hypnotherapy as persuasive healing. A good hypnotherapy script is going to have embedded in it two things. There's going to be this linear narrative story over top. You're in this place, doing this thing. And woven into that is a secondary or even a third story that challenges perspectives, beliefs, actions, variations on that. And it's in a similar way as EMDR, it's kind of giving you this thing to look at or have your attention on, this story, a pleasant story, there's the voice, but there's this other information coming through too at the same time, typically geared towards a very topical thing. Depression, sleep, diet.
I want to touch on that, but just before that, I wanted to ask you that. I mean, we've the word trauma has come up a lot. PTSD. Now, is PTSD is the effect that the trauma had on you, or those are two separate things?
PTSD is a diagnostic term. Didn't first emerge in the Diagnostic and Statistical Manual that the psychiatry uses for assessments and diagnosis, but it's become the key phrase used to describe. Let me consult my notes.
Yeah.
Persistent PTSD, persistent and frightening thoughts and memories of their ordeal. So the key piece there being persistent. And a lot of the components of PTSD are the intrusive stuff. Can't stop thinking about it, can't stop getting a startled response. And then there's utter flow through things, the intrusiveness, energy loss.
So
it's super interruptive. And it's a result of trauma.
Right. I was just going to say, so the trauma was the actual act and the PTSD is a lingering after effect.
Bingo.
Okay.
Couldn't say it better myself.
Oh, yeah, I'm sure you could.
And that brings up the notion, okay, trauma. What is trauma? On the one hand, one person's trauma is another's kind of rotten day. Now, I've had many clients who had really horrific childhoods, and in terms of physical treatment. And when we're setting up the thing, and I say, okay, and where does this all land now? 0 is no bad feeling, 10's the worst feeling. It's about a 2. And I feel like I'm having their feelings for them. I'm like, holy frack. I'm thinking that should be an 11. But that's where it's at for them. Because it was either normalized or are they dissociated? Have they got it tucked hard enough away behind the blind spot that, yeah, we're just kind of getting a look around the glimpse of the corner now. Okay. Get into the process, and then often as memories and other stuff drips out, oh yeah, I can smell the smell of the damp basement now. Then the brain starts to mobilize and other stuff starts coming, for instance. And then I mentioned there's small t traumas, but in clusters. If you're getting a consistent message for 3 years in high school from your band teacher that you suck at guitar, that's going to land somewhere. And if you're not getting support at home and learning music, if you come from a non-musical family and you try it out a few times and it doesn't work, that's going to create a pretty significant belief. It could be a small trauma. It might not keep you up awake at night, but when I have people make their trauma lists, they kind of hit the highlight stuff that they're really aware of. It's on the surface. It's salient. They've come in, even though I tell them, until I meet you, don't think about it. Yeah, we all go back and make the list. And then I always ask them though, okay, were you ever bullied? Have you ever been pushed over? For every female I've worked with in my entire career, and I've got a daughter, I've got 2 sisters, I'm adopted, I have 2 mothers, and I have not known a woman on this planet that hasn't been intruded upon by a male, either subtly or grossly. I just had an intake on Monday with a woman in San Diego. She only wanted to work on stuff kind of post-30. And at the end, I trust my brain. I said, look, you're a female. Have you ever been assaulted? And she looked startled, and she kind of sat back. And she did the eye referencing past memory thing with her eyes. And she went, oh, yeah. And she remembered something from when she was 14 and when she was 30. Got that on the list. So this stuff is slippery. And what's normal for one person does stand out.
I've brought this up before with everyone that's going to come on. Another thing, the other thing, us sitting outside the building before we go in, some of the conversations we have before we go see our therapist or think about taking any form of therapy is we don't want to live in it. I want to deal with it and I want to leave. I believe we behave that way. Is my leg's hurting and I go see a specialist. I don't want to go on forever.
This needs to end. What
can we do to mitigate the pain so I can kind of move on? Am I simplifying it too much? Because we do want to move on after it. Like I want to be able
a future.
Well, I want to be able to say there's a great life after dealing with your trauma, and I'm a living proof of that. And I don't know if I'm using the right word or in the right context. My modality that I used was talk therapy with Dr. Paul James, who's great. But after I kind of healed, and now I found myself in certain situations, new relationships, saying I'm fully responsible for this decision that I'm making. A line I would never say to myself. Mm-hmm. I'm responsible for where this goes because I know where I'm going with this. And when it kind of came to an end, there was no blame. It was just like, no, I actually chose to come here. It was really a great way of thinking, like a clean home. I knew where everything kind of was.
Eyes are wide open, no veils.
Eyes are wide open. And I was going slowly through life. And you mentioned earlier the amygdala or something. I wasn't going from a state of panic running all the way through. It was very kind of calm. I was noticing my breathing in all my situations. Wow. Getting back to the question is, we don't want to live there. I mean, I don't think anybody does. And I'm proof of that is that you don't have to live there. Your tools are given to you. A healing happened through the talking process. And it wasn't the next day thing, but I was walking a little differently. And the next week I was walking a little bit better. Yeah. And the only simple example that I use is going to the gym. Is, I start working out, a little bit of pain, but as time goes on, I get better at it.
If you do these things.
If I do these things, am I oversimplifying it? And with EMDR, what is the effects after the fact? So now they've done the 3 sessions with you or 4. What are you noticing after the fact?
Great question too. When I did my training, bless them, they were adamant that we get our tune up too. So I was then 54. I'd done a lot of work on myself. 25 years of recovery from drinking, a bunch of relationships, all sorts of stuff. I thought I'd kind of scrub myself pretty clean. And yeah, why not? Moving to the U.S. was challenging. Being in this all-women's college as a straight white male, I was getting some darts thrown at me. And I don't know. 4 days later, I'd gone through my own list, ended up becoming like about 30, 32 targets. My takeaway was, and this is before I completed all my EMDR training, you sort of do it all at the same time, my brain literally felt different. I felt lighter. Colors were sharper and more saturated. The process was exhausting physically, but it was kind of like being at the gym. I felt I had more energy. I literally felt about 5% bigger. My sleep was amazing. And certain contexts, people, places, or things I was surprised, even less, had less texture or trigger for me. Some colleagues were able to kind of toss out stuff at me, and where my inner 7-year-old still might have been a little, screw you. But now it was more like, that's not a bad point. Variations on that. It was very subtle. What I see with my clients is very similar. Getting to sleep back, being able to get back to work, being able to be touched again. I had a client in North Virginia who had witnessed their neighbor's teen daughter's suicide just by accident. Came around the corner, this thing was happening. And I got brought in there kind of as an emergency situation. And me and her wife sat with her in her living room for about 3.5 days. And we did the flash technique, which is very truncated EMDR. It's not EMDR. It doesn't have eye movements. You talk about hypnotherapy. The flash technique is I count out loud 1 to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Somewhere in that sequence, I say the word flash. When I say the word flash, you blink or scrunch your eyes 3 times, and we're not looking at the awful thing. It's tucked away. You don't think about it. I have you hold in your mind's eye a beautiful image, something that has intense positive meaning for you. Now, your unconscious and my unconscious knows that we're there for a very specific reason, this awful thing. But we're not going to talk about it. We set it aside. We know it's there. We're kind of pretending not to look at it. That's the beauty of the mind. You can make it. Multitasking's a lie. You can actually only put one thing in your consciousness at a time. But with that super speed of the thinking, the mind wants to go other places, and it does. But you do this 1, 2, 3, flash, 4, 5, 6, 7, 8, 9, 10. Do that for about 10, 15 minutes, and we check in. Okay, let's bring out the awful thing. Where does that feel now? 0's no bad feeling. It's an 8. Okay. Do you notice anything about it? That's a very cognitive frontal lobe question. It's almost like a task. It's not an emotion question. It's a task. Yep, I can see the shed where they were, and then, okay, great. Tuck it away, back to the beautiful image. 1, 2, 3, 4, 5, 7, 8, flash, 9, 10. 1, 2, 3, flash, 5. Random. We did that for 2 days. Went to a 0. Brought up a bunch of other stuff about her childhood, family of origin. We worked on those, just using the flash. And she was able to get back to sleep, and my understanding was she got back to work about a week later, and her partner, who was a peace officer, stayed in touch with me, and she initiated herself some reconciliation stuff with her father, because there had been a suicide with one of her uncles.
Okay, what happened there? And did we? What happened? I mean, did we bury it because we thought of a whole bunch of stuff because it's going to come back, and
Right.
that goes to the self-help stuff, or this is something different?
Yeah. Bury it? No. Again, EMDR, Flash, or the progressive counting technique, we haven't got to that one yet, doesn't erase memory. Sometimes I wish we had a ray gun, we could actually erase memory. No. But it takes the, as my friend in Vermont would say, it takes the piss out of it. And we take a horrific image and drain of its emotional charge. A number of things are happening in this process, either with EMDR, Flash, and really in talk therapy as well. It's a more longitudinal process in talk therapy. You are reiterating and re-experiencing a trauma. I mean, if you're talking about a trauma, you're letting your mind's eye fill in the movie. You're seeing it, talking about the emotions, its values, you're filling in this narrative story. If you do that in a context that's different from the bad thing, emotional safety, if I'm mobilizing my voice, my body language, in my practice, my cats are there. There's lots of feel good. There's a lot of emotional safety. That is inherently disrupting. It's a reorienting. There's a psychological process of the orienting effect. If we keep experiencing an old thing in a new context, it gets reoriented to the new context. So that we could call that, that's part of the basis of extinction therapy or exposure therapy. Exposure therapy is just running the movie over and over and over and over and over and over and over until you basically wear it out. It's like you start with a 200 grit paper, and the 400 and 800, and we're down to the 1600 grit paper, and we're just kind of like polishing it until there's nothing left. Technically that works, but when you go back, say 6 months after the fact and check, okay, where's it at now, 0 to 10? With EMDR, it consistently stays at a 0. With exposure therapy and talk therapy, typically it kind of ferments a little. It still has texture, 2, 3, 5. And trauma-focused cognitive behavior therapy, very similar. Cognitive behavior therapy, cognitions. What am I thinking? What behaviors do I mobilize around this thing? And how do I want it to be different? One of the key components within CBT is do a different behavior. Do anything different, you will disrupt it. Take a different route to work. Brush your hair or your teeth or shave with your non-dominant hand. Start that simple, and you're going to be interrupting neural pathways.
And is that the idea that it gets brought up by Joseph Dispenza, talks about the plasticity of the brain, and we start going a different path?
Bingo.
Consistently, we have to do it, not just once.
So, does it bury it?
No.
No, but it gets it reoriented. This is where we end up using qualitative words instead of specific brain structural things. Well, we can see that this area of the brain is different. With EMDR, we see researchers out of Australia, Spain, and Italy using MRI see that there's a relinking of the right amygdala with the frontal lobe, so cognitive versus feeling, that rebuilds a bridge there in activity, and there's a significant diminishment. I'm losing my terminology. I've got to do more neuroscience. There, the hippocampus, right at the base of the brain there. The hippocampus actually changes weight and mass in the process of EMDR. Pre-post testing with MRI shows you get upwards of a 6% increase in mass. So this is it is a neurophysical process, which for me qualitatively does jibe with what a lot of clients talk about. My brain is fizzing, my brain feels different. The image I'm using, it's harder to hold on to. It's desaturated, it's pixelated. It seems like it's black and white and further away. So there's a diminishment. It's probably the biggest word. So buried, no. I tell all my clients, usually in the first rounds, when it gets close to 0, how could this be a 0? That's nuts. It was awful. I still want to kill them. But yeah, but we started at an 8, oh yeah, I feel okay. What keeps it from being a 0? I had a client who made bad choices. She was bringing some cocaine back from a Central American country and got caught in that country. She was in one of their prisons, several of their prisons, for about 3.5 years. Horrific experiences. And she's kind of appropriately proud of having survived that 20 years ago. We ended up negotiating and arguing. She was fun. No, it's going to be a 0.1. That's where it stays. Screw you. This is my badge of honor. Great. Okay, we'll call it an atmospheric 0. And it lives in the long-term filing cabinet back there. She can pull it anytime she wants and hits play. Window dressing's still there. Sound effects are still there. But it doesn't jump out at her and keep her awake and sweaty at 3 a.m. anymore.
I want to touch on 3 other things before we kind of wrap up. Is you mentioned just before you started something about the flash therapy? No, numbers.
Flash technique.
Yeah.
Progressive counting.
That's it. Yeah. What's that?
Wait, there's more.
Oh, yeah.
Go to my website.
Exactly.
These are the 3 main tools I use. It's probably 90% EMDR. And then when things are really hard to be in the same room with, the flash technique is nice. It's only 10 seconds. Up, 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 up. Nice little sputters. It's a good place to start for the hard stuff. Progressive counting is very, very linear. You're going to take the memory, you're going to watch it like a movie, literally. Client had a memory. They had 2 older sisters. They got an orange cat. They all loved the cat. Dad didn't like cats for whatever reason. And his memory was of Dad chasing Tibbles the cat through the backyard with a broom and feeling the cat's terror. This is like the child was 3 when he remembered this. So I had him watch this like a movie. Can see the cat running out of the house and Dad whipping around the house chasing the cat with a broom. Well, exposure therapy would have us simply run that movie over and over and over, over and over and over, and then you tell me when it feels better. What we do is we bookend the movie with, okay, what were you doing before the bad part happened? I was in the sandbox in the backyard, and I loved creating things. What were you doing when the bad part was really over? We were having dinner, and Tibbles was having its food, and Dad had actually apologized for being a jerk. Okay, so the counting part is I'm going to count out loud 1 to 10. You be at the beginning of the movie, before the bad part happened, watch the movie, get to the end of the movie when the bad part was over. 10 seconds, go. 1, 2, 3, 4, 10. Did you get to the end of the movie? No. Make sure you get to the end of the movie, even if you have to kind of fling yourself over the finish line. 10 seconds isn't very much for a movie. Progressive part is next round, 20 seconds. Next round, 30. Progressively up to 100 seconds. So you really expand the movie. Granular detail. So that's kind of a lot like exposure therapy, very linear. You're watching the movie. EMDR is very, very associative. Look at the one image and be aware of whatever's popping up around it. So progressive counting, we're checking in each round. How bad is the bad part now, or the worst part of the movie? Starts at an 8, gets up to a 10, still a 10, still a 10, and it always ends up creeping down to 0 because the mind loves to multitask. Yeah, Dad was a jerk, but he got me that drum set when I was 9. Confounding information, contrary information, novel information. Oh, okay. And then we reach this reconciliation of stuff. Oh, yeah, I love cats. I became a veterinarian. Okay, so it gets to a 0. That's progressive counting in a nutshell. And we reduce the counting as the numbers come down. We end up back at 0, and then when it gets to a 0, we do a few rounds of, we want to make sure it's a 0. Does it feel a little better, a little worse, or is it still the same?
I want to go back to a question I had from before, and we were in the middle of it, but we talked about PTSD. We went to trauma, depression. We haven't brought that up, and it was brought up today at the coffee shop before I kind of brought you on. And where does depression sit in all of this? And can we use EMDR? So I'll ask you, kind of two questions here is,
Okay.
what is EMD therapy useful for? So who do you see coming through your door?
Right.
And then you can touch on depression as well.
People are showing up pretty much with anything that makes them feel bad. Recent divorce, childhood stuff, of course, sexual trauma, work stuff. Go down the list. Current clients, middle-aged woman with a bad relationship with her teen daughter, recent financial disaster, quite a plethora of stuff. Will it work with depression? Yes. In that, I haven't come across a person with depression yet.
Can you tell me, in your words, what depression is? Like, so in my head, I've figured out, okay, there's trauma. From the trauma, there is remaining PTSD that's from the trauma often. And then when I heard this gentleman speaking today, who is from UBC in psychology, he just said that depression can kind of just show up in your life after. And during COVID, a lot of people had some more time to spend with themselves. And like, I might be depressed.
Right.
So, yeah.
Really good point. Depression, I mentioned the DSM, the Diagnostic and Statistical Manual of Psychiatric Disorders earlier. The DSM would tell us to be clinically depressed. There's very distinct qualifiers around what you're experiencing and how long you've experienced it. My glib answer is, if you're really clinically depressed, you wouldn't be here. You'd still be in bed, and you could near paralysis. Having said that, we all experience a range of spectrum around depression. Low energy, your sleep's kind of funky, no spring in your step, not able to mobilize to do cool things with cool people like you used to, play your instrument, the stuff that normally would kind of water your heart or quicken your heart. That's in the realm of depression. Feeling you're in a rut, feeling you're stuck. People get into relationships and jobs and then sort of come to 2 years or 5 years later, oh, wow, how did I get here? I'm really not digging this. Now, we kind of get into the realm of, well, wait a minute, isn't this kind of the blues? Well, yeah, not getting what you want is part of life. It's more a matter of what do you make of it and how does it make you feel? Now, there's appropriate depression, sadness, loss of a job, breakup of a relationship. Not getting what you want sucks. But is it going to be, an annoying 1, a prickly 3, or is it kind of like a near catastrophic 8? And we've got some nifty assessments. The Beck Depression Scale Index asks some questions, and those are embedded in what are you feeling, what's the intensity, how long have you been feeling it? And the time factor is really big with depression assessment. Typically, if you've been in that non-movement stuck zone for, say, more than about 2 months, you're probably on the edge. If it's been 6 months or 2 years, okay, you're depressed. Now, I haven't talked about medication at all. I'm not anti-medication, but we've all seen situations with anxiety or depression where people have been medicated or taking meds for years and years and years. That's a problem. In my mind, somebody's not doing their job. Best case scenario, if you've got depression and you're engaged with some sort of mental health support, outreach worker, social worker, psychologist, psychiatrist, counselor, you're also they're going to be getting quite coachy with sleep, diet, exercise, and whatever doing cool stuff with cool people looks like for one. And doing all of that will shift depression, typically. If that's not doing it, something else is happening. So this is a very roundabout way of getting to EMDR. Depression, ask anybody with depression, what do they believe about themselves? What are their feelings? And there's going to be something negative. There's going to be a negative belief there. What would you prefer to believe about yourself? Oh, I'm good at this. I love me. And you can create an image of, sometimes there is something specific that made you feel depressed, an event, a person, place, or a thing. Or you can also create an image around, what does depression look like? And I've done a fair bit of this, and it's usually something dark, morose, and heavy. And focus on that, move your eyes, and be in the room with those beliefs and the feelings. Stuff always comes out. Memories, places in one's life where it didn't have volition or control. Messages about worth. You can have a lot of capacity, a lot of intelligence, and a lot of resources. But if you got the core message growing up that you're never going to amount to nothing, that's a small t trauma. But if it's extrapolated from age 4 to 17, that's going to be pretty hard to shake off. And that's really subtle. And so depression is always a tricky one. My position with depression is, even with the MDR, the only real response to depression is you have to get off the couch or the bed, put on your pants, and go out your front door, even if it's just down the hall. Rinse, repeat. It requires mobility, mobilized action. You got to do it.
I don't want to end this because there's so much more here.
We could go on, and I haven't taken a shot across the bow of mental health professionals.
Well, yeah. So maybe we should end it on that. But just before you do that, we had just discussed. I constantly say this because I can take them all on. I talk about the whole self-help world.
Sure, New Age language.
Language
that has a place too. Like Louise Hayes and all those affirmations. If you're thinking peace and love to humanity in a cyclic way, that's way better than everything sucks. Everything sucks.
Well, let me touch on this now. I think I can kind of put my hat in here now and start talking like an expert here. Is that the challenge with the self-help is it's a great idea in that sense.
Absolutely.
But the idea of putting the affirmation up, let me take a step back. I read, my go-to guy is a guy by the name of Neville Goddard. And Neville in the 1920s, 30s, just prior to him, there's another guy named Émile Coué.
Oh my.
He was a French pharmacist, and he was curing his patients by using a seance, a word over and over again, a statement. It was every day in every way, I'm getting better and better.
Classic.
And
yeah.
It got so popular in the early 1900s. He came out to America, and I found the original book, 1920s, in a bookstore in Portland that talks about his voyages throughout America. Indeed. And how he was helping people, and it was mainly a placebo effect. But every day and every way, I'm getting better and better. But it was the consistency.
That's not placebo.
Okay, fair enough. But it was the consistency of something. Neville Goddard talks about feeling is a secret, that our lives are a reflection of the consistency of our feelings. So with that said, going towards narrative therapy, I'm going to have a consistency of saying my affirmations every day. But with the affirmation, I'm going to give myself some time to feel myself in the position and create an image in my mind. Here's the challenge, is I understand that, and doing the work is not pretty. You have to do it every single day. It's a Monday to Sunday thing.
It's a practice.
It's a practice. The practice doesn't get put in. The cooler part is Sunday night, I got my green tea, I'm going to put my pictures up, I'm going to say my affirmations. But it's a consistency of what you did from Monday to Saturday that's going to change your life. And that's the part where, because it can't be that all these self-help books out there that we may have on our shelves, but your life is exactly the same. Something's missing. The work's not being done.
One of my favorite words in all this process is continuity. No matter what you do, at the end of the day, changing habits. James Clear, Atomic Habits, more recent book.
I have the book there.
Hello, Dolly. Okay.
Yeah.
Start small. You want to mess up somebody's head, get them to brush their teeth or shave or comb their hair with their non-dominant hand. Bonus points for brushing your teeth with your non-dominant hand in the opposite direction you usually stand in your bathroom. All journeys begin with something weird. So the continuity of just implanting the tonality of the words every day in every way, better person, that's beautiful. That's got to feel good. And as much as there is a certain triteness to the New Age, naivety gets thrown out too. But they are all getting it right. They're all on the right path, absolutely. And we can get distracted, though, because we don't uptake one and run with it and see the effect. It's too easy to go to Banyan Books or wherever and go with the flavor of the month. And it's not so much doing it, it's getting the right book. That's part of it, too. But anything that is a novel riposte to the negative thought or the behavior is a huge shift in habit. And if you do that for, say, a year or 3, you will be a different person.
Okay, with that said, if we're going to do, that's a big if, is also the other aspect of the self-help is, and I'll use myself as an example, was I also smothering the feelings and not feeling the feelings because I just want to move away. I didn't want to deal with it. I don't want to deal with the trauma, but I'd rather do the affirmations and so on. And the unique thing was I got pretty far with the amount of trauma I had. That in and of itself was pretty phenomenal to me.
And absolutely. And a lot of people get really far by hook or by crook. Fake it till you make it is a real thing. Oh, wait a minute. We call that performance enhancement. But at the end of the day, my sense is if you are transparent and truthful to yourself and others, and you recognize, I've got these personality traits that rub people the wrong way, or I've got these deficits, I'm not doing what I want to do, something feels off. If we're able to sit back and look into the mirror, which takes a lot of guts, there can be that final piece. Now, to kind of go full circle, on the one hand, what we're describing here is somebody who's comparatively high functioning. And one of my objectives, having worked with, it always sounds awful to toss out these terms, but we have to use relative terms, working with a very challenged population, downtown East Side, 6,000 HIV positive injection drug users and all the layers of services and everything else. What's stopping them from shifting forward? Well, my inner social worker and social justice person says, the service, economic, socio-political systems, let's not forget about racism and forced education through residential schools and on and on and on, multiple layers of systems. What's the first order of business? Deal with the trauma. And so I'm trying to cover a bunch of bases at the same time. Sliding scale to make myself more accessible. That's one thing. I've got some pro bono slots. I'm getting referrals from wealthy Americans, God bless them, in their American dollars. Great. That's going to enable me to do more at the low end for the people we could say really need it. It's one thing to be a healthy neurotic, as they used to use that term, and go and do talk therapy as a lifestyle for ongoing fine-tuning, for instance. But if one's going to go that route, why not get into don't want to use the word spiritual practice. This all ends up being kind of prescriptive, but say have a teacher or a guide and do that fine-tuning stuff. If one has already more or less arrived at a whole self, there's ego strength, there's direction, and one's in a position to be clear about the meaning of one's life and why they're doing what they're doing.
I just want to close up that last loop. We were talking about the self-help and the what's the word? The feeling I was having was when you were saying that is that again, we're on the outside. I can take all these books.
Mm.
But I'm kind of telling people, hey, listen, you're at your own devices, and your own devices have brought you this far, where you
Your best thinking has got you this
your
far.
best thinking has gotten you this far, and your behaviors of reading 10% of the book. And this wonderful woman, again, who I bring up a lot, one day she said to me, she goes, I'm paraphrasing, is that we were just, people are just reading the quote. They're just posting the quote of a book that's 200-300 pages. Like there's a whole book and a conversation supporting that process, and they're not understanding that. I read 2 in my life. 2 I heard, and I've stayed with them, and I was like, that's good enough. One was be the change you want to see.
Mm-hmm.
And I think I got that late 1980s. I'm so old. And I was like, this is a good one. I'm going to run with this my whole life type of thing. Fallen a couple times, but I mean, I like to think this is a reflection of that.
To live by.
And 2, we're one, but we're not the same. We get to carry each other. That was a line of a U2 song. And we're one, but we're not the same. We get to carry each other.
That works.
And so whatever, I see that. And again, we're on the outside. There are great books to get. The James Clear book, one example in the book is about going to the gym. And there's a gentleman who is told, okay, what you're going to do is you're just going to go home and put your clothes on to go to the gym. Try that for a week. So you see your behavior of where your clothes are.
What does it feel like?
The week after that, I'm going to go to the gym, but I'm going to go in, 15 minutes is the most I get to spend here at the actual gym. And then it kind of builds up from that. And I did the same thing there.
Sounds a lot like exposure therapy.
Fine. So, but again, we're still on the outside, and I'm kind of getting to the point where I say to people, listen, I get it. You got the book, and you're still in the same space. Go get therapy.
Take action.
Take action with a professional.
Okay, so here's the punchline. Oh yeah, here comes my piece with professionals. This is going to be quite positive.
Yeah, take your shot now.
Well, no. A lot of different flavors. We've got Gestalt, transactional analysis, psychoanalysis, Freud, Jung, Byrne, Wittgenstein, philosophy psychologists. Oh, don't forget Buddha. We get invested in our school of thought. I'm a Rogerian, da-da-da-da. So 20 odd years ago, starting in this field, I wanted to pick the right path, right? So I did my research. Which one works? Well, smarter minds than we did the macro studies, because we're, however many 100 years into psychotherapy and outcomes. Macro studies indicate they all work. The 90% factor is, brace yourself, rapport. Is there emotional safety? Do you actually kind of like the person? That is 90% of it. Methodology actually isn't that important. It will facilitate and induce change and growth. It's true. Now, therapists, we get very invested in what we do. I used to work with photographers, and I'm a sports photographer. I'm a wedding photographer. My position was, got to make a living, got a mouth to feed. You actually could probably take a really great picture of anything if you know what you're doing. In my mind, a good clinician therapist is going to have multiple tools to use. Don't be a one-note song, because you're going to need to be really adaptable, because you're going to get a whole range of people that are going to need different things. So why EMDR? It can be short and sweet. Get in, focus on the one thing, beaver away at it. What I'm finding is, even with folks that have, I think my record was something like 62. Somebody's had 62 distinct traumas on their list. This is somebody in their early 60s. At the end of the day, we kind of clustered the stuff up, and in about 5 months had kind of pressure washed through this stuff. And they were in a very different place. It's very, very proactive. You show up and you do this thing. It's very different from showing up and complaining about mom and dad for an hour and having a paid friend. There's the shot. If one man's opinion, if somebody is still talking about mommy and daddy at the 4 or 5 month mark and there isn't been any progress, somebody's not doing their job. So that's more of a social work position. We want to get stuff done. It's got to be movement. We want value. Don't waste time. Don't waste money. This is expensive no matter how low you can go. Anything more than $30 is a commitment.
With that said, to wrap this up, how can people get a hold of you now? As this goes on YouTube and it goes onto this website as well, I'll have your contact information there. Is there anything else you'd like to say to the listener? And there will be a part 2, because I can tell there's so much more, but we're going to finish this up, and there will be a part 2 that comes up. We'll do it at some point. But is there anything else you'd like to say to the listener?
Simply that I'm incredibly grateful for what you're doing, and putting this forward. As I mentioned earlier, this is something that I've wanted to get closer to for quite a while in terms of disseminating these ideas, these modalities. There's more than one flavor, and none of them are perfect, but buyer beware. Know what you're getting into. If you're considering getting mental health support, need to be aware what's a good fit for you. Someone younger, someone older, a male, a female, a specific orientation or cultural orientation, and go with what you think is going to be appropriate. Do not, I repeat, do not be afraid to question or be quite directive with your quote-unquote therapist. If you don't like what they're saying, say so. Question it. That in itself, just like how I get my clients to text me if they feel like their head's going under, that might be the first time you actually stand up to power. Wait a minute, that didn't make sense. Brian, why would you say that? Oh, well, that in itself, it can be a phenomenally therapeutic thing. I don't know about you. I don't think I really stood up to anybody until I was about 18. And we were all trying to figure this stuff out, breaking through the family programming. So for the listeners, VancouverTraumaRecovery.com. On the web, I've got clients all over the world now. Hooray for COVID and Zoom. It actually works phenomenally well on Zoom. Is there a je ne sais quoi 2% factor of doing it in person? Yeah. There's something to be said for the eye hug, and it does work better in 3 dimensions. It's been my experience. What I really love doing with people is the 30-minute consult. Do those around noon hour some days, and just having a chat about, okay, what's going on, what's going to be the best fit for you. That's critically important, I think, as well. If I think something is going to work better for you, I'll say so. That's also really important too. If you're shopping around, be a little leery if people are getting enthusiastic about, yeah, we should start tomorrow. You really need this, and just put your credit card in here. Yeah, just saying.
With that said, thank you very much, Brian. I appreciate your time.
Thanks for having me. It's a real honor.